My name is Cathrin. I am an artist based in the US, originally from the UK. I am 37. When I was 25 years old, I was diagnosed with IgA nephropathy. It was actually kind of by accident. I was going in for a visa medical and they noticed elevated protein in my urine, elevated blood in my urine, and went on for further testing, biopsies and so on. And then I was diagnosed with IgA nephropathy. And I remember being told at 25 that I'd be on medication for the rest of my life and feeling kind of overwhelmed because this is the first time I've ever had to be on anything and realizing there's never going to be an end to it in any way. And for me, it felt a bit like a ticking time bomb. The progression of damage to your kidneys is bringing you closer and closer to having to go on dialysis or having to have transplants. My nephrologist at the time said the ultimate goal is to keep my eGFR in the normal range to help delay or avoid the need for dialysis or a kidney transplant. So I started ACE inhibitors, and I've been taking them for quite a while, and I wasn't really seeing the improvement. And we even maxing out the dose and changing the diet, I stopped eating quite a lot of things that I really love. And even with that, I wasn't really seeing an improvement. It always kind of stayed the same. When I moved to the US and therefore needed a new nephrologist, I found this really highly regarded doctor, and he was telling me about this amazing research paper on a new medication that's come out that was designed to target the gut area of the body that is thought to be a source of IgAN. So that's when he told me about TARPEYO, and it was really interesting. I got to look at all the different studies and all the data, not just from when people are taking the medication, but what was happening to them when they finished. And I've gone from a mindset of, okay, medication every day, that's it. If you stop, it gets worse, to seeing, you're taking the medication, and then after you stop the medication, still improving potentially, or, at least not getting worse. This is the first time that I could see a medication that was specifically for my condition. I started taking TARPEYO about 4 months ago. Obviously, it's a 9-month course, I'm only halfway, and I've started to see a reduction in the protein. And my kidney function has remained really consistent. My doctors are very happy with my results. I'm very pleased with the results. I've been on medication for my kidneys for a very long time, and this is the first time I've seen a reduction like this, and that is very exciting. And obviously I can only talk from my experience. Everyone is different. TARPEYO is something that you take in the morning. I take it as soon as I get out of bed because it's important not to eat within the first hour of taking it. As far as side effects, I had light cramps in my legs in the morning, but that only really lasted for the first month or so. Not only did I have a good solution with my nephrologist, but I felt like it was something that is really just more of an adjustment phase. I don't know if that'll be the same for everyone, but it certainly was for me. Once I was prescribed TARPEYO, I was working with TARPEYO Touchpoints, a group that will help you navigate the insurance and all of that side of things. TARPEYO is mailed to me every month, and my insurance now fully covers it, and there's a zero copay. After 9 months and I finished my treatment, the next stage for me is my husband and I are gonna start a family. The chances to create the future that I've always wanted is actually a possibility that's not terrifying. And I couldn't ask for more. This is the first time I felt like my IgAN is in my hands.
Important safety information. Do not take TARPEYO if you are allergic to budesonide or any of the ingredients in TARPEYO. See the end of the patient information for a complete list of ingredients in TARPEYO. Before taking TARPEYO, tell your healthcare provider about all of your medical conditions, including if you have liver problems, plan to have surgery, have chickenpox or measles, or have recently been near anyone with chickenpox or measles, have an infection, have high blood sugar levels, prediabetes or diabetes, have glaucoma or cataracts, have a family history of diabetes or glaucoma, have or have had tuberculosis, have high blood pressure, hypertension, have decreased bone mineral density, osteoporosis, have stomach ulcers, are pregnant or plan to become pregnant. TARPEYO may harm your unborn baby. Talk to your healthcare provider about the possible risk to your unborn baby if you take TARPEYO when you are pregnant, are breastfeeding or plan to breastfeed, It is not known if TARPEYO passes into your breast milk or if it will affect your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with TARPEYO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. TARPEYO and other medicines may affect each other, causing side effects. How should I take TARPEYO? Take TARPEYO exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take TARPEYO. Do not stop taking TARPEYO without first talking with your healthcare provider. Take your prescribed dose of TARPEYO one time each day in the morning, at least 1 hour before a meal. Swallow TARPEYO capsules whole. Do not open, chew, crush, or break TARPEYO capsules before swallowing. If you miss a dose of TARPEYO, take your prescribed dose at your next scheduled time. Do not take 2 doses of TARPEYO at the same time. If you take too much TARPEYO, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking TARPEYO? Do not eat grapefruit or drink grapefruit juice during your treatment with TARPEYO. Eating grapefruit or drinking grapefruit juice can increase the level of TARPEYO in your blood. What are the possible side effects of TARPEYO? TARPEYO may cause serious side effects, including effects of having too much corticosteroid medicine in your blood, hypercorticism. Long-time use of TARPEYO can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercorticism: acne, bruise easily, rounding of your face, moon face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, buffalo hump, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. Adrenal suppression. When TARPEYO is taken for a long period of time, chronic use, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with TARPEYO. Risk of immunosuppression. TARPEYO weakens your immune system. Taking medicines that weaken your immune system makes you more likely to get infections. Avoid contact with people who have contagious diseases such as chickenpox or measles during treatment with TARPEYO. Tell your healthcare provider right away if you come in contact with anyone who has chickenpox or measles. Consult with your healthcare provider regarding appropriate vaccination scheduling. Tell your healthcare provider if you develop any symptoms of infection during treatment with TARPEYO, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of TARPEYO include swelling of the lower legs, ankles, and feet, high blood pressure, muscle spasms, acne, headache, upper respiratory tract infection, swelling of the face, weight increase, indigestion, irritation or inflammation of the skin, joint pain, increased white blood cell count. These are not all the possible side effects of TARPEYO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.